Hello, this is Charles Reynolds. There's a really severe problem with erectile function called Peyronie's disease, named after the French physician who discovered it. And I consider it one of the most disturbing problems, second only to erectile dysfunction when it comes to maintaining the marriage bed, because it causes, from scarring of the connective tissue of the penis, it causes a bent penis that can sometimes mechanically not be able to be used for sexual intercourse, and it causes pain. So a man will actually start to avoid his lover because he's afraid if she becomes aroused, he can't reciprocate and not want to hurt her feelings. So it really separates couples. Well, I'm happy to say that there have been a lot of progress. There's been a lot of progress made for non-surgical treatments of that. The surgical treatment is the last step because the risk include infection. It makes the penis smaller, and it doesn't really take care of the problem, of course, of erectile dysfunction. So you want to try to avoid that if you can. Here's the ways that we now know that it can be avoided. By the way, as prevention, you can do things like exercise and avoid smoking. We know that often occurs after trauma if you're having sex with women on top and there's a hitting of the penis with blunt trauma, that can cause it. But so routinely we've had injections of verapamil. Recently there was a FDA approved version of collagenase, which you think about is really just a chemical surgery because you're injecting something that dissolves the tissue that's scarred, and as you might expect, if you dissolve too much, the penis fractures and no longer can become erect. So there's some risk to that, and it can be expensive, $50,000. So we have urologists in our group that have quit using that for something that I think maybe works better. I don't think we actually have research to back that up. You can use a penile traction therapy, which I don't really like as much. Just something about walking around with a rubber band pulling your penis down to your socks is not a good idea. But it doesn't sound, it's not fun. It doesn't sound like fun. An erection device using a vacuum, in the British Journal of Urology, it showed about half of men got better from it and canceled their surgery. It's simple. It's 10 minutes twice a day, and usually they're better in about 12 weeks. But cortisone I don't like because it leads to hypertrophy. The tissue gets thin. I got tongue-tied. But my favorite, because the side effect is a better erection, is PRP. They say with an HA filler, but the HA in this case is just being used to activate the PRP. So you don't have to have the HA. The particular study they're referring to, the reason they refer to that is they're referring to this study by Ronald Varag, who researches for a region which makes a kit that's marketed in Europe that has an HA. We don't have that kit in America, but you can activate the PRP with calcium or even with the vacuum pump. And this has been shown to work better than the collagenase. It costs 50 grand. So if you know someone that this might help, I hope you'll let them know about this and so they can talk about it with their doctor.